Hi, I'm Dr. Devayani. I'm a plastic surgeon practicing in Mumbai. In this video, I'm going to talk to you all about how to take care of a post-surgical dressing. A lot of plastic and cosmetic surgeries, whether it's a tummy tuck or a breast reduction or a body lift, will have scars or cuts which are pretty long. While recovering from these procedures, you may or may not also have a drain put inside under the skin to take care of the swelling and the fluid which can collect inside. So in these cases, you need to know how to take care of the incision and the dressing and how to take care of your drain. When I send patients home from the hospital, I ask them to empty the drain out every day, measure it in a beaker, and let us know what was the drainage and how did it look. That gives us an idea of how to monitor and how to call you back for removal of the drain. When taking care of your dressing, initially till the drain is there, you will not be allowed to have a complete bath. However, you can continue sponging or use antibacterial wet wipes, body wipes, which can be used to clean the body. Below the level of your surgical dressing, you can always have a bath, and I always recommend that my patients use the traditional bucket and a mug and do not use the shower to have a bath. The spray from the shower can be very strong and it can dislodge the surgical dressings. After the drain has been removed, your entire surgical area will be covered with a waterproof dressing, and which gives you flexibility to have a bath. Again, though I recommend patients use a mug and a bucket, they can always take a shower, but let the shower hit your body in the non-operated areas and let the water flow over your dressing so that your dressing does not become wet and it does not come off. The waterproof dressing keeps your wound dry and lets it heal on its own. Generally, after any surgical procedure, it takes about 48 hours for the skin to stick to each other and make the dressing impermeable to the outside environment. So once the waterproof dressing has been applied, the skin is protected from any outside sources of infection, and we try to keep the waterproof dressing on for at least 5 to 7 days to make sure that there is no interference in the healing of your wound. However, if in this period your dressing comes off or there is any disturbance in the surgical operated area, then there are ways in which you can clean the dressing yourself and change it at home if you're not able to come to the clinic. Always keep an alcohol-based sanitizer at home with some sterile gauze pieces which are available at all chemists. You can keep a few pairs of clean gloves. They need not be sterile for every small dressing. If your dressing has come off and it's open and you can see the surgical incision, just clean it with the gauze and alcohol. Apply the ointment over it as prescribed by your surgeon and cover it with a waterproof dressing. These waterproof dressings are also available at most medical stores. After 2 weeks of keeping your surgical incision covered, protected and dry, it becomes completely dry at the end of 2 weeks and is safe enough to be left totally open. The way I suture my incisions, there are no stitches involved and all the stitches are on the inside. They are buried inside. So there is no question of any stitch removal and the skin is totally healed at the end of 2 weeks. Following which, you can resume having a regular bath, even use a little foamy soap on the incision to take care of the external scabs or little oils which may be there. Once you've had your bath, do not rub the incision area. Just pat it dry with a towel and apply ointment as prescribed. This should take care of your incision and you're ready for the scar treatment to start about 3 weeks after your surgery. Based on how your skin is, I will prescribe a scar gel or a scar tape or some kind of scar treatment cream which will go on for about 6 to 8 weeks. So this is in whole a summary of what you should do to take care of your incision, of your surgical incision, and make sure that your healing is perfect, is comfortable, and you get the best possible result. If you found this video helpful, please like it and share it with somebody who's had a procedure or who may be considering the procedure. Thank you for watching and don't forget to subscribe to our channel.